morning, everyone. I hope you all slept well. I hope you all are filtering into our session. In just a few minutes, we're going to hear from Mr. Bob Wald about Clusterbusters and what's been going on. I have a few announcements to get us started today. First of all, this morning I did send out an email with all of the links to all of the sessions. You can also find the links to sessions in our open chat. We have a lobby. It's at the top of the page that I sent you this morning, the link to that. And that's a place where you can go anytime and chat, hang out with other people who are attending the conference. So please feel free anytime to jump into that session during the day. It will be open all day long. I want to give a special thank you to our sponsors, Eli Lilly, Electrocore, and Two Fun Guys. Without them, our conference doesn't happen. So I just want to give a big shout out to them and appreciate them. Even though we're doing this virtually, it still does take a lot of effort and there's a lot to put together. And I just, a heartfelt thank you to them for their support of Clusterbusters and our patient conference. It's a wonderful thing for us all to be able to get together. So thank you. I also want to thank all of the volunteers. There's people in this room with me who have flown to Chicago so that we could be together and make sure this event runs smoothly. Joe McKay, Mark Mazzullo. So thank you for that. And then the people at home like Sean and Andrew and Todd and Heather and Shar, Ainsley, well, she's here on the screen with me, Ainsley, of course. All of the people, Anna, who's here as well, who have volunteered their time, and if I'm missing anybody, I'm so sorry, but have volunteered their time to helping make this a success. I really appreciate you guys. And let's see, do I have anything else? Oh, if you notice on the slides that I just showed, we're going to have a Twitter chat on Saturday. It's a change to our program. Instead of the session with Todd and myself on Sunday, I said Saturday, but I'm sorry, I meant Sunday. We're going to have a Twitter chat about oxygen. We will be emailing you more information about that, and we'll also be posting it in the chat today and tomorrow to get you ready for that. For those of you that don't know, right now, oxygen is a big issue in the United States. The Centers for Medicare and Medicaid Services say that home oxygen is not important for people living with cluster headache, and we all know differently. So we are working very hard to get them to change their determination, and there's an open comment period right now. So we are doing everything that we can to make sure that CMS knows that this is a really important issue to us. So we're going to focus a lot of our presentations on that issue because it is timely and is important. I think that's all I have to say this morning. Make sure as you're going through the day, you pay attention to the links for the different sessions. They do change. It's not just the same link all day long. And that's for a variety of technical reasons. But make sure you pay attention to the links. Like I said last night, if you're not finding where you need to be, please be sure to email me at conference@clusterbusters.org. I'll put that into the chat so that you have that. But absolutely feel free to reach out if you're having any difficulty. I know this is different and new for a lot of people, but we want to make sure everybody has a really good time. And so thank you so much for being here. I'm going to turn this over to Ainsley.
Good morning, everyone. I'm saying good morning, but it's afternoon for me. It's about 4 o'clock. Warm welcome to everybody. Lovely to see so many people joining us, so many participants today. So our next speaker, Bob Wald. Well, what can I say about Bob? And I have to try and do this without getting overly emotional. Bob is an amazing man. I can see him there. An absolutely fantastic man who is the founder of Clusterbusters and our executive director. Bob has gone way above and beyond the call of duty since he started Clusterbusters. I know for certain that he's taken calls at crazy times in the morning, crazy times at night. He's never refused anyone his time. and he's a very special man. He looks out for all of us, whether he's known you for years or whether he's never met you or even seen your face. He is a tremendous person with a huge heart, and he's also an incredibly close and dear friend of mine, and I love him very much. Anyway, we're going to start with Bob's presentation. Take it away, Bob. Thank you. Oh, sorry, just one thing I wanted to mention. Bob would like to continue with his presentation without any interruptions, but we will ask you to post your questions, which Bob will answer at the end. Thank you.
Thank you very much, Ainsley, and good morning, everybody. I'm really glad that you're all here with us today. Okay, why is that going down?
Use the arrow key. Oh. I don't know. There you go.
Okay. So, yeah, once again, good morning and welcome to the 15th Clusterbusters conference. It's a little bit different this year, but one good thing is we've been able to get a lot of new people to log in and see what we do at our conferences, at least as far as presentations and that goes. So welcome to everyone. It's great to see some of the old faces, and it's great to see all the new faces. What I'm going to do today is kind of bring you up to date on everything that Clusterbusters has been working on over the last year. And it has been a really busy year. We have a lot of things going on, some that have been completed and some are in the middle of getting done, and others are still just ideas on things that we want to build on. So I'm going to let you know what's happening and what's going to be happening. And
You don't have an invite for that?
some of the major community issues that we deal with all of the time and are always on our mind, and these are the things that are part of our mission statement and looking for ways that we can improve the community. So as far as diagnosis, that was always a major problem with us. When I started this 20 years ago, a lot of people were waiting 8 years or longer. The average was between 8 and 4 years for a proper diagnosis. And in the last 20 years, a lot of work has been done by a lot of people, and it's now down to an average between 1 and 2 years. That's still way too long. It would be nice to be able to get that diagnosis the first time you go into a doctor. But we've made a lot of headway, and we have other things still that we're working on that are going to be looking to improve on that. The oxygen issues, we'll talk more about that, but that's always been an issue with access to oxygen for cluster patients. Treatments and access to those treatments, something that, you know, that's what Clusterbusters started with, was trying to find a new treatment. And we found a lot of things that help people along the way. So increasing support availability. There are a lot of people out there that don't know that there is support. And we need to be able to reach those people. Everybody that's been to a conference really knows how important it is to be able to actually see somebody else and talk to somebody else that has cluster headaches. You know, it's one thing when you go in and talk to your doctor and he's never seen a cluster patient, but it's something else when you go and talk to a person that actually has clusters. That's life-changing in a lot of ways for people. So that's one thing that we've always worked on, trying to give to people. We have always been, we've always been based on increasing research, increasing education, and that means patients and the physicians, and also increasing and support all sorts of different advocacy and awareness projects. Let's take a look at some of the things that we're doing to improve these issues. So, got an echo here. So, One of the things that we just released on our new website is a new diagnostic tool. Like we had talked earlier, I mean, it's always been an issue about getting a proper diagnosis. So we worked with some physicians and worked on an online diagnostic tool that helps people get the proper diagnosis. You can find that. It's called the Chat 3. It's on our website. There is the website location is there on the screen, but we're also going to be posting that in the chat, I believe, and there will be a document where you can get all of these links that I'm posting on my screen here. So you don't need to hurry up and write those down. We will be giving you these links. But this diagnostic tool is going to be really important for people that are misdiagnosed. I mean, what we have found working with the migraine community is a lot of the misdiagnosed people go years and years being told that they have migraine, especially women. And if you're not real sure about what your diagnosis is, go try out this tool. You can print out the results, and if it gives you a different result than what your doctor has told you, then bring in the results and discuss those results with your doctor. As far as the oxygen issues go, you're going to be hearing a lot about that this weekend, and it certainly has been one of Clusterbusters' main issues that we've worked on for the last 10 years, going to Washington, D.C. and working with the Alliance for Headache Disorders Advocacy, and helped put in the review that is now being looked at by CMS, the appeal, and we'll be talking more about that as we go throughout this weekend, and we do have that chat coming up. We need as many people to write in comments as possible so that the people at CMS know that it's a pretty large community that's asking for this change. And it's really about more than just people that are on Medicare that can't get oxygen. It's more looking at the entire community and letting people know that we are out here and we all need access to oxygen, and it's a major issue for the entire community. And this is just one of the roadblocks that's in the way of everybody being able to get oxygen and doctors being able to prescribe it and learning about it as an effective treatment. So it really means as much to the entire community as it does to just the people that are currently or about to get onto Medicare and Medicaid. So, but we'll be talking a lot more about that over this weekend. So research has always been one of our main missions, and increasing the amount of research, which hopefully leads to better treatments, more treatments, and eventually a cure. So what's been going on this year, we just got another grant from Eli Lilly, which is going to help cover the next 4 rounds of publications from the survey that was done by Larry Shore and Dr. Mark Burish, and all of that information that was collected and all that data that was collected. There's a lot of great data that we have that is going to be important to be able to get published and get our story out there. And so we're going to be working very hard this coming year on getting those new publications out. That survey already produced one very important survey on oxygen that was the main backbone of the appeal that we put into CMS that's hopefully going to get that reversed. So now we've got some other issues that are in that survey that are going to lead to more research. We're also involved in additional research that's going on at 5 other companies that have research projects going on right now involving cluster headaches. We're working with Lundbeck, Impel, Zosano, CH-TAC, and the Beckley Foundation, and those are all different research studies into cluster headaches. And we are deeply involved with these companies, and Clusterbusters is helping put those together. One of the things that was mentioned by Dr. McGeaney yesterday when he was discussing research, there really has been an explosion in cluster headache research over the last probably decade. And it really comes from the community itself making a lot of noise and letting people know that we're out here and we need new treatments. And the more we make our face seen in medicine, the more research that's going to be presented and hopefully lead to other treatments. So there is a lot of work going on around the world. There is a lot of it going on in Denmark. The Danish Headache Center is specifically looking at psilocybin and ketamine for cluster headaches. In Basel, Switzerland, they're looking at LSD for clusters. Zurich, they're looking at circadian rhythms for cluster headaches. In Germany and Italy, there are Botox studies going on. And there are also studies going on in Netherlands and France and Belgium and Hungary and United Kingdom and Norway and all around the world. There is research going on specifically for cluster headaches. And it's very important. And that is a real change from the history of cluster headache research. I believe there's more going on now than it's ever been going on before. And that's just because of the community out there making everybody aware that we are out here. So some of those research studies that we're looking at in BOL and we're involved in, just bring you up to date a little bit on where those studies are on psilocybin and BOL 148. So we've already had the pre-IND meetings on each molecule, and they were successful and went through everything at the FDA, and we've passed all of that. IND is an investigational new drug, and this is the process you need to go through to get clinical studies done, phase 1, phase 2, and phase 3. A lot of people are learning a lot of things about different phases of clinical studies while we're looking for this vaccine for COVID that's hopefully out there, but we're going through this process, and it is a very difficult and long process. So we've already been successful with the FDA on the pre-IND meetings. We're now preparing full IND submissions for both of those molecules for further study. And we're very close to getting those approvals and moving forward. So the pharmaceutical grade BOL is already being manufactured so that as soon as we get the approval, we can open up the clinical study and start getting people into a clinic to start receiving doses of BOL to test in a clinical setting. We're also currently manufacturing and encapsulating psilocybin suitable for further development, which is, we're moving along pretty well on psilocybin for cluster headaches, and you'll be hearing more about that a little later in this conference from Emanuel Schindler. And next level clinical trials on both of these, psilocybin and BOL, will go one more beyond where we currently are in clinical trials. So basically we're in phase 1 right now and planning on phase 2 in 2021. So things are finally moving along fairly well. Took us between 15 and 17 years to get to this point, but we've been moving a lot quicker since then. So we're making a lot of progress, and I'm really excited about this coming year, what's going to be happening in the clinical settings. Another thing that we're working on as far as research goes, and we're still in the initial stages, but we're pulling everything together here. We're working with the Association of Migraine Disorders, which is a wonderful organization, and they're deeply involved in research and are really committed to doing that with cluster headaches along with migraine, and also partnering with CHAMP on this. And we will be applying for a grant to help pull this together. But what a consensus conference is you pull in all the top researchers from around the world, get them in one room, get all the best ideas out there, and try to set a direction for that research so that everybody's looking for the same goal at the end and doing research that helps put the puzzle together, rather than everybody working on their own and not knowing what other people are working on and which direction. What we're trying to do is pull everybody together and pulling in the same direction. And hopefully we're going to be able to pull that together for 2021. But one of the things that we've learned putting together this conference is when you do something like this on an international basis and trying to find time in everybody's schedules, it's not as easy as it may sound, but it's an important step in research for cluster headaches, and just want to let you know that that's kind of going on behind the scenes. So onto education and awareness and support, some of the things that are happening and what we've been doing this year. We launched our new website and we are continuing to expand it. So just about every day, new information is added. We've got a great library where you can check out all sorts of research, and a lot of other things are available now on the website. We're constantly posting new information. We have a lot of videos already uploaded there. Some of these presentations will also be uploaded to our video vault. So if you haven't seen the website in a while, check it out. We're really proud of it, and it's really a great information hub. If you can't find what you're looking for there, just send us an email and we'll try to find it for you. One of the other things that we're building on this year are support groups. We've already done some Zoom meetings, and more are planned as we're working towards a time when we can have in-person meets again. But so we have some local groups that are already getting together, and were getting together before the pandemic hit, but we're going to build on Zoom meetings, and that information is up on our website, and we have quite a few groups already set up, and you'll probably be hearing more about that also this weekend. But if you don't have a group set up in the area that you're living in, you can always join one of the groups that already is set up and join on Zoom, and then we'll end up, if there's more people in your area, we can zero in on making groups for specific areas. But there's already quite a few already set up. So if you're looking to get on a Zoom support group meeting, you can go there and start signing up for those meetings. One of the things that we do to get together and bring about awareness is our annual 5K walk that's organized by Ashley Haddle brilliantly every year, and we raised almost $8,000 this year. And it's things like that that make us able to do and offer the things that we're able to offer. So we'll be having that again next year, and you'll be hearing more about that. But it was a very successful event this year. Some of the other things that are going on and are going to be coming on, and you'll be hearing more about as soon as we can start in-person meetings again. So we will be back in Chicago 2021, and hopefully the next time I show up at this hotel, I'll be able to pull up and I'll see 50 people outside in the smoking area, and people being able to get together. But we're already starting planning that one. You'll be hearing more about this also, an upcoming event. We're planning on a camping trip in 2021, and you'll be getting some information. We'll be doing some polling to find out exactly where we're going to be having it, but planning for it is already being taken care of, and we think that in early 2021 we'll be able to do an in-person meet. It's a perfect setting outside. We can socially distance, and I can certainly set up a tent 6 feet away from Ainsley's tent. So yeah, Ainsley already told us that she's more than happy sleeping in a sleeping bag in a tent. So we'll make sure that we have a nice tent set up for her. Another thing that we're already planning, and we would have had it sooner, but it takes a lot of work to put these together. Clusterbusters is finally going to make it over to Europe, and we are going to have a conference there the same year that we're having one in San Diego. We're going to be planning one in Milan, and we'll be giving you more information about that real soon as far as dates and locations. But we're really excited about being able to finally get over to Europe. I have a lot of friends over there that I've made over the years, and so it's going to be a lot of people that I'm going to be able to get to see. And I know that we have a great group of supporters over in Europe, and we think Milan is the place to do that. And you'll be hearing more about that soon. Some of the other things that we're doing as far as expanding our reach, we're working closely with CHAMP regarding our diversity outreach. We realize that we have an issue with, most of the people that we're able to reach out to are on Facebook, but we understand that there are a lot of people with cluster headaches that aren't on Facebook. And we need to find other ways of reaching people. And we really feel that that's an important thing to do. And we're doing a lot of things in that area to try to expand our outreach to get to underserved populations. We think we have a lot of important information to share with them. I know everybody that is sitting here on this call has important information that they would like to be able to share to somebody else that may not have internet, they may not have a laptop, they may not have ways that we all have of staying hooked up together. So we're going to be looking for ways to be able to reach those people. We're also expanding our social media and outreach and working with the American Headache Society's TAC group. You should be hearing about this real soon on a video promotion. And so we are working with them for our outreach to try to get to more people that way. One of the things that is currently available on our website, and there is other information out there on how to help us do this, but we're looking to build a physician finder that shows people a list of cluster headache doctors and specialists that really know what they're doing. And sometimes it's not a neurologist, sometimes it's some other type of a doctor that has really taken an interest in helping some of you treat your cluster headaches. And what we would like you to do, I mean, if you are really happy with your doctor and would recommend that doctor to somebody else in your area, there is a sign up on that you can go to. Once again, there's a link for that we'll get for you. But if you're happy with your physician, we would really like you to be able to recommend that doctor, and we're going to put them on a list on our website. And we're also working with the American Headache Society, the TAC group, on training sessions for headache specialists that we feel really need a little bit of extra education specifically about cluster headaches. We all know the same thing happens that happens in medical school. If they get 4 hours of learning about headache treatments, 3 hours and 45 minutes of that is on migraine, and maybe they're getting 15 minutes on cluster headaches. And a lot of the same thing goes on a lot of the other professional conferences. And so we are working with AHS to put together some training sessions specifically about cluster headaches and proper oxygen prescribing and use, and some of the other things that we've come to know are important treatment options for people with cluster headaches. So if you've got a good one, let us know who it is. This is another list of all of the different organizations that we are working with and partnering with to work on advocacy and education projects. You can see them on the list, but all of these organizations are taking an active role in helping the cluster headache community, whether it's patient access, research, different treatments, So I'm really grateful for all of these organizations that are really taking a positive and active role in cluster headaches. One of the other things that we're doing on the international end is we're working with the Canadian Headache Society, who is really zeroing in on wanting to help people with cluster headaches. And things are really spread out pretty wide up in Canada, which is a really nice thing. On one hand, it's nice to have all of those mountains around you, but it makes headache treatment pretty difficult for some people if the nearest headache specialist is 4 hours away. So the Canadian Headache Society is really wanting to be able to provide better access to care for people with cluster headaches. And they're partnering with us. So we are going to have some special pages on our website for Canadian Clusterbusters, and we are building a mailing list specifically for people in Canada so that we can keep them up to date on new information and any alerts that are coming from the Headache Society up there. So if you're hearing this from somewhere in Canada, be sure you go to our website and sign up for the Canadian mailing list specifically, and not just the mailing list for the website. There is a specific website and mailing list to please sign up on, because they're really interested in being able to reach out and help the cluster community in Canada. So one of the other main objectives that we're working on are pediatric clusters, which we think that we really need to teach the medical world about, because a lot of doctors don't believe that pediatric clusters actually exist. And we know through our own research and others that more than 20% of people with cluster headaches actually start clusters while they're in either their pediatric or teenage years. And we need to better get those people diagnosed earlier. And so one of the things that we're doing is we're teaming with the Children's Hospital of Philadelphia, and are going to be working on a new study that we're putting together to try to bring awareness to this issue, and also to increase the further research for it. One of the things that we really think is involved here is whether somebody's symptoms change as they grow older, and maybe they don't have all the symptoms when they're 2 years old other than the pain. So we're going to find out how those symptoms may change as kids get older. The usual checklist of symptoms, whether your eye is turning red and it's running, things like that. If it's not happening, then these kids aren't getting properly diagnosed. So that's one of the things that we're going to be looking at, and we hope to get that research started this year. Some of the other advocacy efforts that are going on, our annual Headache on the Hill trip, we're going to be doing it again this year. Hopefully we're going to be able to celebrate by that point, as far as hopefully getting a positive review out of CMS on oxygen. But we have a lot of other issues going on in DC on the legislative end also. But Headache on the Hill this year, it's going to be early 2021. There isn't a date yet because we're not real sure how the government's going to be working, and if it's going to be working in the first quarter of 2021. But it is going to be a Zoom event. They are not making any personal appointments for in-person meetings the first quarter of 2021. So when you see us start talking about people signing up for that, we need a lot of people from all 50 states. And since it will be Zoom account, we'll be able to sign up a lot more people and make sure that we get every state covered. So as you can see all the different things that are going on, we have a lot of work going on, and we need some help. So we do have a volunteer page on our website. So if there's anything that you saw of projects that are going on that you're interested in helping us expand, please feel free to sign a volunteer form, and we'll certainly find a place for you. It's kind of all hands on deck here. We've got a lot of things going on. The more help we have, the quicker we're going to be able to get these things taken care of. So that's about it from me, and you're going to be hearing a lot more about most of the things that I talked about already as we go throughout this event, and hear from the specific researchers and doctors that are doing a lot of these different things and are involved in the research. So thank you all for being here, and Ainsley, if you've got any questions, I'd be happy to answer.
Sorry. Go ahead.
Okay.
Okay, just give me a second.
I just want to take a moment while we're glancing at the chat. I didn't see too many questions come in, so if you have any, please put them in now. But I wanted to take a moment, because I forgot at the beginning of this, to acknowledge that today is September 11th. It's a pretty heavy year for some of the people who are in the room with me, or a pretty heavy day for some of the people who are in the room with me, and some of our presenters as well. So I just wanted to take a moment to, first of all, thank them for their service to our country, and just acknowledge the tragedy that happened 19 years ago. And just I want to take a moment to think about that, and also just to really be gentle with our speakers this weekend as we go through this and we all work through these emotions together, okay?
Okay, so I'm not really seeing any questions come in as yet. So for, for our attendees today, if you have any questions for Bob, if you could post them even into the chat at the moment, and Bob will be more than happy to answer those questions for you.
Sure. And you can do that at any time, and we'll be keeping eye on the chat throughout the day. So anytime you ever have any questions, just throw them up in chat, and we'll find them and try to get answers for you. So
sure. And if you have a question that perhaps we're unable to answer today, we will come back to you with an answer, or where to find an answer